It's like having car insurance. Nobody wants to get into a car accident, but you have to have a plan if God forbid something happens. Same thing with planning for future stages and if you do decline in your physical or mental capabilities.
What if your greatest caregiving crisis could have been avoided just by having one hard conversation a few months earlier? Today's guest has made it her mission to stop families from walking into the fire unprepared.
Welcome to From Leads to Leases, a CCR growth podcast that helps senior living providers transform their complex challenges into opportunities. Listen in for stories from industry leaders, innovative strategies, and insights. And with our expertise, learn how to increase occupancy faster, guaranteed.
All right, today's guest is Lisa Santiago, a home care consultant with nearly 15 years of experience across the continuum of senior care, from independent living to assisted and memory care, and now home care. Her expertise doesn't come from textbooks, it's lived. Raised by and around loved ones with dementia, and now the caregiver and power of attorney for a special needs family member, Lisa understands what it means to navigate care through love, responsibility, and exhaustion. With an MBA in finance and a consultative, no-pressure approach, she helps families see what's ahead and plan for it before crisis hits. So, Lisa, welcome to the show.
Jerry, thank you so much for having me. That was a great introduction to me. I think I may need to steal that for the future.
Oh, sure. By all means, go right ahead. That's awesome. Glad to hear it. Glad to hear it. It's always good. Well, welcome to the show. I want to start talking about the personal why. This industry is so interesting. Everybody's got a story of how they got into it or fell in love with it or why they stayed. Your story begins with 3 grandparents with dementia and an uncle you now care for. What did that teach you about caregiving long before you entered the field?
Well, thank you for asking about my personal experience. It's been a journey watching even my great-grandmother go through needing caregiving services when I was much younger, and then having one grandparent after another who needed assistance, and having family members who would step in. Now that I'm in a home care consultant role, I try to take that approach and what I've lived through and what they've lived through to the needs of my clients and their families, and just give them that overall resource and support, because as I'm sure you've heard many times on your interviews and in your industry too, people don't always know where to start, and it's a struggle. Even my uncle, who cared for my grandfather at one point, I would talk him through all the different resources. My grandfather was a veteran. There were resources that he could get through the VA. And it was going back to that old, well, I want to stay home. I want my family member to take care of me. I don't want assistance, which really drove a lot of that. That is where my personal journey started, in having family members. But I've also been working with seniors for the last 15 years, as you had mentioned. And so I've seen all different levels of need, from very independent all the way up to memory care.
And you're definitely right about that. Most people, when they start this journey, they've never done it before, so they don't know where to start. They don't know what questions to ask. It's a really, really challenging time. It's emotional time. So that's very difficult, I know. And even on the flip side of what you just said about your loved one wanting to stay home and be looked after there, I had the opposite, where my mom, after my grandmother passed, she wanted to bring my grandfather home because she felt like she could provide the best care for him, and then quickly realized about 3 to 6 months later that that wasn't going to be the optimal situation for him. And then we ended up finding an amazing senior living community for him. But it is interesting how guilt can kind of drive those conversations.
Yeah, and it's unfortunate, but a lot of people go through these things, as you know, in steps and stages. And sometimes they try to do things as they've promised, to have somebody step in and really be that caregiver. And then sometimes they'll hire somebody like a home care agency like ourselves to do maybe a few hours. And then they realize, there's pieces missing. And sometimes then they'll take the step to move to a community, whether independent or assisted living, or, as you know, sometimes people just wait so long, they go straight to memory care, which is something I hope people during this conversation is it's really my point to drive home, not to wait till the inevitable if you know that it's going in that direction, but to really plan for it.
What have you seen up close emotionally and practically that you think others might miss?
Well, I think the biggest thing that I've seen even more recently is that people who don't have that familial structure around them locally. So maybe because I'm in Florida and when I was in New York, I saw a different picture. But people who may count on somebody who's not here, maybe an adult child is in a different state or in a different place, or even across the world, because as you've seen, everything's global now. And so people are all scattered all over. And the the thought of making that move, people don't think about, right? Because they think, oh, well, I'm okay now. And maybe, somewhere down the line, I need some services. And then they literally wait until there's a crisis, going to the hospital or having a fall or all these different pieces. And they don't have somebody. So sometimes you see people who, rely on neighbors. Or I had one recently who counted on her landscaper who started moving in and doing some things around the house, more of from that side of thing instead of caregiving. And they're afraid to even ask for help, or they don't think that they need it. So there's a lot of different pieces to that.
I think, too, the most dangerous time is when nothing's wrong. And you said most people only plan when they're in crisis. Why do families avoid those hard conversations until it's too late?
Well, you and I, prior to this call, when we were talking about statistics. And I think it all boils down to people thinking it's not going to happen to me. It happens to everyone else and just not me. Years ago, I took one seminar with a renowned neuroscientist, or he does a lot with neurology and dementia up in Massachusetts. His name was Dr. Tanzi. We got into the auditorium and he basically said, if you could look left and look right, one of you is going to end up forming dementia or Alzheimer's. And, doing a lot of work, I'm sure, just like you, with the Alzheimer's Association, there's a lot of statistics around that. And even just memory impairment doesn't fall on everything, because then you also see people with mobility challenges and things like that they don't even take into consideration. I think a lot of people wait because they don't think that they'll ever need it. And then the reality are the average age in this country is 78, and at 85, you are 2/3 more likely to develop some form of dementia. That's not, again, talking about any mobility challenges. So I think we've seen a shift, especially after the pandemic, when people were doing a lot less exercise, less socialization, and all the things that really, the connections that we need to have in order to continue to age gracefully and safely, and really keep the focus on how we can age without having those types of issues. Things have just shifted. And plus, you see all these wonderful people on the TV and the news who are living to 100 and 102
Yeah.
and 105. And the hope and the faith of how we are going to age just remains that way, that we won't have that need over the long term.
I think a lot of families avoid that conversation too, because you go from not talking about it at all to opening a fire hose and all of a sudden wanting to hit somebody with all that information at the same time. And it's just overwhelming. The first thing that somebody wants to do is push back, get defensive, deny that this might be something that they need or something they might need in the future. What are some simple steps or proactive steps families can take today, even when everything seems fine?
Well, I think the biggest thing that people forget is that they should look at and research all the different options before it even becomes a conversation in a crisis. I have a lot of resources myself, and one of the attorneys I work with actually stated that, it's not like things have years ago where your mom can step in when you're 18 if something happens and speak to your physicians and doctors in the hospitals. You really need to plan from the time you become an adult. And those things can change over time, but at least have basics like a healthcare surrogacy or healthcare proxy and a power of attorney as you're aging and you want to decide what that aging process looks like for you, to have that plan in place so that it doesn't become, you having to deal with, let's say it's yourself and you're dealing with something with your spouse, or you're the adult child and you have to deal with it from your parents' point of view. If you can't talk about what that looks like, then you have to make those hard choices for that other person, which is where a lot of people get held up in the process because they don't want to make the decision for someone else. And so now you have a question of, what does safety really look like? Because safety is different for all different people, and how you can continue to help somebody still remain independent with the least amount of services, right? Because that's the goal, to keep somebody independent as they age, whether it's home or in a community. And then, what does safety look like for them?
What happens when a family waits too long?
So unfortunately, we get those types of calls a lot. You can typically will see somebody who's living in their home. Usually I hate to talk in general terms, but you'll see somebody, either loses a spouse and one of them overcompensated for the other person. Let's say, Jane was counting on her husband for all the things that are financial, or, paying the bills, making sure the house is, taken care of. And I hate saying it only about women, because men do that too. They've counted on their wives for things as well. And then all of a sudden they wake up one day and that person is not there. Their person is not there. So they start counting on other people. Like, it could be family members, it could be neighbors. And now that burden has shifted to, I'm going to take care of myself, to now somebody else needs to step in and help me. And so it's really tough when you're looking at that point where it's shifted and now all of a sudden mom has a fall, and the fall is what is the catalyst for her ending up in the hospital. And then you have a hospital stay, which can be very disorienting for someone. You're up all night, they're poking you, they're prodding you, they're testing you. So you're not sleeping, you're not in your home. And you can see people completely change with a hospital psychosis and memory loss just from going to a hospital visit. So how can you have that conversation to try and avoid that piece? And then the next step of that is, let's say the daughter says, okay, well, dad fell, he's in the hospital, and I don't think that he's doing okay to go home. So now you're in a crisis of, you have to have a confrontation and a conversation while you're dealing with it. And so that really is something that, if you have that conversation ahead of time and you talk about it, all the different things that can happen, it's like having car insurance. Nobody wants to get into a car accident, but you have to have a plan if, God forbid, something happens. And it's the same thing with planning for future stages and if you do decline in your physical or mental capabilities.
I mean, with insurance too, maybe I don't have a plan, but at least I know that someone has a plan, right? I know my insurance company has a plan if I get into the accident. So I think that makes sense. One of the things I notice in my community too, I would say it's probably 70% of the residents here are over the age of 65. And just about everyone I speak to who owns a home says they're not leaving their home. No one's selling. Everybody wants to stay at home. Everyone wants to age in place. And with obviously the number of seniors in the baby boom generation just exploding into the senior living space, I think there's a lot more people who are going to be pushing back in that sense. But staying home isn't always the right answer. What misconceptions do people have about aging in place?
Well, I think a lot of times I hear, and I'm sure you've heard this before, is they think that Medicare is going to pay for the next level of care. And that's really not a fact. That, you pay into a system your whole life and then you think that something's going to pay back out. The reality is that Medicare, or if you're on a supplement or an advantage plan, it's only going to cover short-term things. for a few hours a day. It doesn't cover 24-hour care. And so when you're looking at people and they say, okay, I'm going to stay home forever, and if something happens to me, I'm going to bring in care and it's going to be covered. Well, that's really not a reality. Unfortunately, if you have financial difficulties, Medicaid will sometimes pay for care at home, not typically 24-hour care. And there's a limited amount of communities that take Medicaid, and usually it's a small percentage of the overall community. So if you have 120 apartments, maybe 10 or 15 are covered, and not fully. So Medicaid, and I don't know if this is in all places, but in Florida here, they don't pay for your whole assisted living stay. They pay for the care piece. You still have to pay for room and board. So a lot of people, when they think, okay, I'm going to stay home forever, there's a financial component that they need to think about in terms of that piece. And then also the physical component. If they can't, let's say, get out of bed at night, but they can't afford 24-hour care, what does that look like? I mean, I've had recently a few clients that unfortunately had no family. They relied on local neighbors to help. And one woman who actually had a friend up in New York who was trying to do things from there to here, but really she was immobile and nobody really could understand the gravity of that, of how she was living on her, basically on her bed. She had the front door open, Uber would get delivered. Let's talk about safety and security. I mean, there's
Wow.
a lot that can happen when you have somebody like that who really doesn't have anybody available. And so is that something that you're willing to live through? I guess is the question that I could ask people. And if not, then how do you plan to not have that happen? So, which is one of the reasons why we were talking about planning today. I can't stress enough how important it is to not bury your head in the sand and kind of look at all of these different pieces, and especially our age demographic. I mean, the baby boomers are getting older, but then the next generation, we may not have access to the same services because of budget cuts or the differences in the tax bases. And I can go on, but you can't expect it's going to get better. It's not always available to you.
Does Medicaid operate the same way with home care as it does with a senior living community, where there's a whole spend down process before it would even kick in, aside from funeral expenses?
Yeah, there's different limits to the Medicaid process with home care. They keep changing the program all the time. And I think the last time, because I don't deal with Medicaid anymore, when I was in communities, we had more of that conversation. It used to be the 5-year look back. And then I think with home care, it was 2 years. But don't quote me on that because that keeps changing, as I'm sure you know, every time they rebudget and look at how they're going to continue to be able to pay for people long term. I think they have to look at, what that actually looks like.
The safety is an interesting concern too. I mean, how do you balance independence with ensuring safety?
It's really about the person in front of you. So I take, like a lot of people in the industry, senior care space, a consultative approach to care. So as a home care consultant, somebody calls me, they ask, about our services, and 9 times out of 10, they want to get to, what's it going to cost? But the reality is we have to see, what are you capable of doing yourself? What do you need assistance with? Is it just mobility? A shower to you may be just, I need somebody standing outside my shower just in case, because I have histories of falls. A shower to somebody else may be hands-on care. And so it really goes through, just like assisted living, we would go through an assessment process, really see, how we can support somebody in still remaining independent, while also being safe. The biggest challenge we usually see is I can take my medications and I'm fine. But the reality is they forget pills or they drop them on the floor and they don't realize it. So it really depends on the person. Person-centered care is the, I'm sure, like you've had on your podcast before, It's the biggest way to help somebody with that balance of finding independence and safety at the same time.
Yeah, that absolutely looks different for everyone. So that makes sense. Your MBA gives you a unique angle in with finance. I mean, how do financial conversations show up in care planning processes?
It comes up all the time because people want to know, can I afford this? And can I afford this long term? So sitting down and, as we talked about, a consultative approach, I always usually start with a question of, well, how did you plan for this stage in your life? Tell me about, what your assets look like. Tell me about what your long-term goals are. If you're going to stay in your home with 24-hour care, it's going to be a lot more expensive than if you're going to do this in an interim basis until you want to make a transition to, let's say, an assisted living or memory care down the road. So really sitting down and making sure that they understand that this could be temporary. It could be a long-term solution. It could be that, listen, I just got out of the hospital. I need, maybe a couple of weeks worth of care, and I want to stretch out my finances as long as possible. So I'm going to do this in stages. I'm going to do what I need right now. And then when I need it again in the future, I can start back up again, which is really the nice thing about having home care as opposed to being in a community,
Yeah,
is that you have that flexibility
not
to
locked into that.
really,
Yeah.
yeah, to stretch things out. And, in finance, you got to do research on a lot of different things. And it's really boils down to what the goals are, in your financial goals. And the same thing would be in your home goals, in your home planning and your care planning goals. So I really do like to sit down and really peel back the layers of the onion and try and figure out what is the real goal and what is the reality of the situation. Because I've also talked myself out of a job before where, somebody says I don't even know where people come up with these things. They'll call up and they'll say, I need 2 days a week, 3 hours a day. And I'm like, well, this is not like a McDonald's where you're ordering something off a menu. Let's talk about what you're really calling for and how do we fit this, number one, in your finances, number one, in your, number two, in your lifestyle. And, if somebody really is alone and immobile and needs more hands-on care and they can't afford it, I've actually given them resources, whether it's a senior placement specialist, or if I know they're close to one of our assisted living partners, I've referred them over to our partners too to help them so that they're not feeling like, okay, well, you're not giving me home care, so you're just going to leave and walk away. And that's really not what I'm here to do. I really want to make sure when I do have somebody who's sitting in front of me and they don't know the next steps, that we've really gone through as many scenarios and resources as humanly possible. You would not be surprised how many people in their 90s who still don't have a healthcare proxy or a power of attorney. It's mind-boggling to me.
One interesting statistic I forgot to mention earlier was the fact that I was at the Argentum Public Policy Institute in March in Washington, D.C. There's one crazy statistic that said 45% of people in this country are planning to rely on the government to pay for their care when it comes to retirement. 45%. I
That's a
was
big
like,
percentage.
wow.
My
Yeah.
God, Jerry, you think about that. It's almost 50% of this country thinks that the government's going to help them. We don't even know if Social Security is going to be around in 30, 40, 50 years. So I don't know how that's going to be possible.
Yeah. And
But
I
we
don't know how we solve that. Is that an education piece? Is it something else they're missing?
The education really boils down to, I mean, if you think about how things have shifted over time, it used to be that mom used to take care of grandma, used to take care of the kids all under one roof. My family is a perfect example. My great grandmother lived upstairs. My aunt lived in the house. My great uncle lived downstairs. And there was a whole communal piece to it that you just don't see anymore. The fact that you have people who don't have children, I mean, we've been slowly, changing the trajectory of how many children, what is it, 1.2
Yeah. 1.2,
children,
1.3, something like that.
yeah, per household. So if you think of it like that, you can't really think that the shift of the burden of family is going to go to the government. And I think it's really, I can get on a soapbox with all different things when it comes to educating our children before they actually graduate high school. But finance is one thing that they don't really talk about. You have math classes and science classes and art classes. But it would be great if we started people early enough because of how things have shifted in this, in this time frame of how much older we're living and how we don't have that support, that familial support that we used to have over time. So I think there's a lot of pieces to that, Jerry, but education is definitely one of them.
And going back to the budget and planning conversation, if a family has care needs, but they have budget limitations, are there specific tools or strategies that you typically would use to help?
Yeah. So a lot of times they don't realize that there's veterans assistance. So if they were a veteran or a spouse of a veteran, there's some financial assistance that they can have towards their either care at home or going and moving to an assisted living or memory care community. And then sometimes people don't realize the benefits that they can get as they're working or invest in themselves, such as long-term care plans. As you purchase them earlier in life, it's a lot less expensive and you can get a little bit more out of it over the long term. Unfortunately, I've actually had seniors who told me, they didn't want to pay for it anymore because the increases that they were getting and the benefits were contracting and they didn't see the value for it. And I've had to tell people, no, don't let that policy lapse. Maybe you just change the plan a little bit to work within your budget, because once you lose it, you can't get it back. As you age or as your health declines, it's so much harder to get policies. And of course, they're not the same like they were 40 years ago anyway. So having those things available to them. So, and sometimes they don't even realize they have it. So we'll start talking about if somebody else, like if they were married, somebody else bought the policy for them. It's not uncommon for me to sit down with somebody. Like I recently had a client. She knew she had a policy. Her husband had bought it, but she didn't know what was, what it was all about. So, as I'm sure if you've ever called an insurance company, 2 hours on the phone waiting, we finally got somebody on the phone to talk about what benefits are in the policy. And this woman had like $530 a day with her escalation on cost of living adjustment in her policy. And she's like, well, what does that do for me? I'm like, you're never going to hit that max, and you're going to it's going to continue to increase cost of living adjustments. So you're in good shape. You can have care at home or you can go to a community. Either way, you can afford it. So I've had situations like that. And I've had people who haven't been able to afford it because they don't have that plan in place. And I've referred them to resources to help them with the Medicaid planning and, utilizing those type of services so that they still don't have, so they still have some assistance. And also talked about layering it with things like adult day or, senior centers during the day. We have one locally that does memory care and it's on a sliding scale and income based. So it doesn't always have to be that you planned. Planning is better. It's much better to have that plan, but you can also see there's resources out there that can also help. And unfortunately, sometimes we also have dealt with people who don't have the means, have memory impairment, and have been financially exploited, where we've had to request assistance from adult protective services, where the legal guardianship process will come into play, which is also another reason why I feel people should plan, because you don't want somebody taking away your rights because you're not in the capacity that you were. And having that plan in place really does take that, or can take that out of the equation.
That was actually going to be my next question on the other end of the spectrum about elder financial abuse. What are the signs families should look out for?
So there's a lot of different things that you can look for. People paying too much attention to someone, we already talked about one of my clients who had a landscaper. I mean, I think it's probably rampant in this one neighborhood where he goes to all the seniors and he tries to help them out. And then from one thing, landscaping, he's now infiltrated, the household. Now he's doing laundry for her. He was doing cleaning up the house, doing different odds and ends around the house like a handyman. And you can kind of see where, things shifted from I'm doing all this work to now doing not a lot of work and still making money off of it and leaving the poor woman in her house without anything there. She can't get up. She can't get to the bathroom. She can't make her meals. She just was really looking at that from, I don't have anybody else. So I guess I need to count on him to do these things. I mean, I've seen, I'm trying to think of other situations where even family members have taken advantage of and exploited their family member because they know that there's finances there. It's really difficult because when you're looking at people from a distance and you can see these things happening, but if you're in the middle of it and you're an older adult and you don't have anyone else to turn to, the reality is other people step in and take advantage. Client who was living in somebody converted a house into an assisted living. And it wasn't a real assisted living because it wasn't licensed. She just told her, you know what, live with me. I'll take care of everything. I'll make your meals. I'll make sure you have your housekeeping done. Everything's going to get done. And slowly, this woman, because she didn't have any siblings, any parents, and any children, the woman ended up being on her bank accounts. And finally, a cousin stepped in because cousin wasn't local, but she had complained that this woman left her with no food one day. And Adult Protective Services had to get called for that because they didn't realize the extent of her decline and how much this woman really infiltrated all the finances. And it was really extreme because she was paying like $5,000 a month for a room. And part of that room fee was to get meals and housekeeping. And it's very sad to see things like that happen, but unfortunately they do happen.
When looking at the entire care spectrum too, where is that line where the level of care no longer makes sense for in home and it makes better sense for them to be in a community or some other arrangement?
I think there's two pieces to it. I think if it's financially unfeasible to stay in the home long term because of the cost, that's one thing that needs to be looked at. But also there's a social piece that people get when they're living in a community versus living at home. And if they're that client's no longer able to get out, even with assistance, and they're starting to feel more isolated and they're missing the social piece of living, then I think it's really much better to live in a community because they get everything literally right there. So they get their meals prepared, they have their housekeeping, they have social, they have friends, they have literally everything by just walking out their front door and coming either downstairs or down the hall instead of having to make that tough decision one day. You wake up, you're saying, I want to go to the senior center, or I want to go to the library, or I want to go to the museum. But oh my God, it's going to take me 3 hours to get ready. And I just don't want to do it anymore. It's just too much work. And sometimes you see that shift in people. Somebody who is really outgoing and craving that interaction with people, not to say that they're not going to get that one-on-one through a caregiver with home care, but they may be looking for something a little bit more than that.
Talking about the industry as a whole, the senior care and senior living industry, I mean, you've worked across communities and now in private home care. What have you seen in the system that you think might be broken or in deeply need of change?
That's a good question, Jerry.
It's a big one.
It is a big one. I feel like it's a loaded question in that there's all of these developers right now and all of the communities seem to be gearing a lot of their new developments to a luxury lifestyle. So not everybody can afford these big, beautiful new places. I feel like, that there's a piece that's missing in that there are a lot of seniors who need a place to live over time or want to make a move over time. But the reality is the income it's so diametrically different from what they want and need to be able to take that transition to a community. You either have money or you don't have money. You either can qualify for Medicaid or you can't qualify for Medicaid. So there's a gap with, I think, the lower to middle income families that just we're not addressing, or even, lower level incomes that, for instance, like my uncle is in a nursing home right now. He's only in a nursing home because he has epilepsy and he needs somebody to manage his medications. He's on Medicaid. And what other option does he have? So there's there's no in between. You can live at home or you can live in a nursing home with 24-hour care. But even somebody like him can't live in an assisted living because he wouldn't be able to qualify for the care piece, even if he found, I'm sorry, the room and board piece, even if he could find a place that would take him with the Medicaid. So there's a big disconnect, I think, when it comes to what care is going to look like over time with all of these seniors aging and needing a place. I forget the statistic, but I think you had it last time we talked. How many new places need to be open over the next, I don't know, 10, 20, 30 years in order to keep up with the demand that we have?
Yeah, even in the development space, the last statistic that I read was we're roughly at about 33% of where we need to be in terms of the total number of units we need between now and 2026 that are currently in development. So we're woefully behind. And then even on the long-term care worker side of things, the data says, like, I think in 2023 we had about 880,000 long-term care workers, and by 2040 we're going to need about 21 million.
Wow.
So yeah, it's pretty daunting where we're at. One interesting thing too, that talking about the developers, is my perspective is that they're pushing the narrative to sell the story. The entire industry wants you to believe that we're not warehousing older adults, right? That these are not facilities, that they're communities, that they're homes. And I think this is why they're targeting the luxury lifestyle, because it's easier to sell that narrative when you have a building that has 80,000 amenities and, all these amazing features and bells and whistles. But when it comes down to it, I mean, the middle market is where most Americans are going to fall, or below it. And so what are we doing to help them?
That's a great question. I will say, when I started my career in senior living, I worked in an independent living community. And it was not luxury. It was very much in that middle market. And where we did excel was having activities really self-contained, where it was either resident run or the activities director did a great job in keeping the calendar very full of different things. So I think that's a great question to be asking when you're looking at the luxury buildings that they're building. But I think there are still a lot of the senior living communities, probably more on the independent side, because they're more cost effective. They don't have the care models. It's a little easier for them to not worry as much on the staffing side of things. So I think that is probably why, I don't know if you've seen the shift. A lot of these management companies and developers are going into trying to, or at least spreading out into the independent space. First of all, because a lot of people don't think they need assisted living and they think they're independent. So there's that mind shift that, hey, I'm not old, I don't need assisted living, and I'm going to need something, but, I'll just move to independent living and get services. So, people wait so much longer now. When I was started in independent living, we had people moving in with aides because they really weren't independent, but there's this stigma to assisted living that a lot of people don't want to move directly into assisted living. So I think if we can find ways to help our partners from a home care perspective in bridging that gap to when somebody does really truly need assisted living, I think that's the culmination of where we're going over the long term to help offset some of the need for assistance without being in assisted living, if that makes sense.
Yeah, that does make sense. And I know from my side, I do see a lot of operators that are now building or developing campuses that do have more than just one level of care. It's independent living, assisted living, and then memory care all in one space, because that's ideally what people want. They want that peace of mind to know, if I'm going to uproot my life and move into a community, can I stay here, or am I going to have to move again in 5 years if my level of need changes, And even I know CCRCs have done that for a long time, but I think that whole CCRC model is becoming a little bit cumbersome just because the buy-ins are so high. I mean, we've got some communities that the CCRC for like the luxury, the best unit they have, it's upwards of 1.5 million as an entry fee just to get in, which is astronomical. And I mean, of course, if someone has the money, more power to them. But realistically, that sales cycle is so long that it's very, very difficult to drive more people to want to do that. There's a lot more to the application process. There's the financial application, the health application, assessment, all of those types of things that have to happen. So for senior living providers, what would you say to them about how to build a stronger, earlier bridge with families before they reach that crisis moment?
So in my local market, I worked a lot with the independent assisted communities to help in that somebody doesn't think they need any services. So we'll go in and help them to support the person until they're ready. So if that quote unquote ready means I'm waiting for my house to sell, or I don't think I need to make that move right now. And then we continue to nurture from the home into the transition. So, like, for instance, I've had one person who her husband needed memory care. And unfortunately, she didn't think that she needed help in the house. So she kept using the emergency room as her, I hate to say it, but like a little break for her. And quite frankly, she was an older woman taking care of her husband who had a lot of needs, including memory impairment. He was a fall risk, everything, everything you can think of. And so one of my partners is a senior placement specialist. She asked if we could at least take care of him until they could figure out longer term needs. So she would take the spouse out and tour places and do things from that perspective. And we cared for him. I think it was just maybe 5 days just to help. But then once we get somebody into a community too, sometimes we'll help with that transition, because I'm sure, as you know, it can be really overwhelming to somebody in a new community when I don't know what the average apartment number is for communities nowadays, but let's say it's 100, 120, and you've toured before, but you didn't memorize the building and you don't know all the people, and people already have friends in the community, and where do you sit and what do you do and what are the activities like? Instead of having that burden on the staff, we can help with the transition maybe for a day, 2 days, 3 days, until that resident gets comfortable. And the staff is still there to care for them. But instead of those 15-minute bursts that they come in and say, hey, it's time to get dressed, it's time to take your meds, it's time to do this, we can at least be with that person and help guide them until they feel more confident and comfortable in the community itself. So there's a lot of different pieces to this. I really love having my partnerships in the community because of that. One way or another, we know that client is being taken care of. And there's a nice warm handoff from us to them because we work so well together.
My last question for you, if you had to look back to before your time in this industry to where you're at now, how has this work changed you personally?
Oof. I think the biggest thing is I don't have any problems with having tough conversations with people. I've had conversations that were tough before, but it's not on an emotional level. Prior to my time in senior care, I worked in banking. I worked as a realtor. It's a tough conversation to talk about finances, but it's definitely not this tough. This is a toughness that you have to be able to stay, of course you want to be professional and you want to have a good rapport with your clients. And sometimes that tough love is not what they want to hear. But if they're in the middle of something that is overwhelming to them, especially since a lot of times the moves that I've made have been an adult child with a parent, helping them see the big picture and giving them permission, it's so powerful because a lot of times they'll have maybe the healthcare proxy and the power of attorney, and the mom says, "No, I'm not moving." And they're like, "Okay." But then they realize a little bit in the conversation that maybe they can help with the move and the transition because they're just not able, their parent just isn't able to emotionally deal with it, or maybe they're just not able to because of memory impairment to make the decision to do it. So I think that this has really given me a hugely different perspective, especially when it comes to my own family members, like my mom and my dad. And I have two uncles that have no children, so I try to help them as best as I can with making decisions. And yes, it's always harder when you're dealing with your own family than, I know you've mentioned that before too, and then with clients and being that resource and that expert to really talk somebody through it. But I think that's the biggest thing that I've gotten out of this is that we're we're very connected in different ways, whether we're introverted or extroverted. We need people. And if you don't have people, how things can so diametrically go in the wrong direction when people take advantage of you, and how you need to be able to look at all these different things that can happen around you and really find somebody that's going to guide you in the right direction. And if I can't help them, I'm going to give them some resources to help them, because nobody wants to feel alone in this world and nobody should be taken advantage of. So that's my personal mission.
I think we always talk about children. We say it takes a village, right? But I think as you amass people and loved ones and family and friends and all of these things throughout your lifetime, I think you've built your own village to the point where now it's time, when you hit that age, for that village to step in and take care of you. So I do love that. And I hope everybody gets to experience that later in life. But it's great if they don't have those resources, that there are people like you who can help point them in the right direction to give them those resources. So Lisa, thank you so much for such a great conversation. Where can our audience go to learn more about caring people or connect with you?
So we're actually in 6 states. We're in Florida, New York, New Jersey, Connecticut, Texas, and the Boston market. You can very easily find us on the web at caringpeople.com. And my personal cell phone number is 954-901-1694. They can reach out to me 24 hours. May not always answer right away, but I will always call back, especially if I'm in my twilight.
Thank you so
Jerry,
much.
this has been fantastic. Thank you so much. I really appreciated having this conversation. I really try to make it my personal goal to have everybody think about the future, not wait till, they have to make their decisions, and really advocate for their needs, but really know what that looks like over time so they don't have to do it in the middle of a crisis.
I know this episode will be so valuable for a lot of our listeners. So I really appreciate you taking the time out. So as we wrap up today's episode, I want to extend a huge thank you to you, Lisa Santiago, for joining us and offering such an honest, compassionate, and strategic look at what real care planning should be. Lisa, your unique brand of empathy, lived experience, and financial acumen make you an invaluable guide to families facing some of life's hardest moments. So if you want to connect with Lisa or learn more about her work with caring people, we've included her LinkedIn profile in the show notes, as well as her phone number and the link for Caring People. As always, we hope you found this episode insightful and inspiring. Don't forget to subscribe to our podcast on your favorite platform and stay tuned for more episodes where we continue to explore the evolving world of senior care, covering everything from innovative care models and leadership strategies to family support, technology, and the future of aging. Also, remember that From Leads to Leases isn't just an audio experience. We're also a video podcast. So if you want to see the video versions of our episodes, make sure to subscribe to our YouTube or Spotify channels. I'm Jerry Vinci, CEO of CCR Growth. Thank you for joining us on From Leads to Leases. Please like, subscribe, and share this episode with anyone who might find it useful. I'm truly grateful for your time and attention. And until next time, lead with strategy and with heart. Chat with you again soon. Thanks, Lisa.
Thanks for listening to From Leads to Leases. Are you ready to fill your rooms faster and increase occupancy? Visit ccrgrowth.com to learn about our Senior Growth Innovation Suite, a proven system to generate highly qualified, tour-ready leads, accelerate sales, and reduce acquisition costs. Let's connect and turn your challenges into opportunities. See you next time.